go out of business, there's probably a lot of other pharmacies all across the state of Texas, in the small towns of East Texas, West Texas, South Texas, who will go out of business also. And where will those patients go to have their prescriptions filled? In my heart, I don't feel like that this Texas legislature, these lawmakers, intended for this to happen. And we're here today to ask them to try to help us resolve this situation. I'd like to say thank you very much for allowing me to be here today. And our next speaker will be Jennifer Riggs.
Thank you. Thank you for the opportunity to present our case. And my position is a little bit different. I'm not a pharmacist. I'm an attorney. And I've been asked to look at the law and to see what actually happened and why we came about with these unintended consequences. And as Lewis and Dorinda have told you already, the Medicaid program serves the most vulnerable population among us. And they don't have internet, most instances. They cannot be advocates for themselves. And so what has happened is the pharmacists and the pharmacies who are affected by this program are the ones who've had to become the advocates for the Medicaid recipients. And they are the ones who are ultimately hurt. But the pharmacists themselves are hurt as well. And pharmacists don't just put pills in a bottle. As Lewis indicated, there is a much stronger role. They're professionals who have a responsibility to their patients. And that's a very, very important responsibility. And that's what we're talking about. The reimbursement here is not adequate to cover their actual cost of providing those services. We don't believe the legislature intended this. This is not about managed care, because what's happened is that the Texas legislature has taken and developed a new managed care system, but they've grafted and taken what is really a fee-for-service system and put it into managed care. And what they've done is abdicate their responsibility to pass reasonable rates. There are still laws in the book that say that they need to pass rates by rulemaking, they being the state. There are still rules in the book that say they have to give pharmacies a hearing and due process if rates are deemed to be unreasonable. There are still rules on the book, still laws on the books that say those rates have to be reasonable. And most important, the state of Texas has by statute and by its Medicaid plan agreed to follow federal law. In order to get federal matching funds, this state has to follow federal law. Federal law has very specific requirements and regulations that require that the state consider not just cost cutting, not just budgetary considerations, but they must consider the effect of reimbursement rates on access to the system. They must consider the cost to the provider. They can't just say, we're going to cut costs by a certain percentage. Our problem with the statute as well, and one of the unintended consequences, is that we live in a democracy. We're here in the Capitol building where the legislature meets. We're going to be talking to the interim study committee today. The committee, our legislators are the ones that create the law. They develop the policy. They tell the Texas Health and Human Services Commission what to do and the Department of State Health Services. They have to tell them how to do it. That's why we have the law. It gives them standards. When the state then delegates to a managed care organization, they also have to tell them how to implement the law. They can't just abdicate their responsibility. But what we have here is a situation where they've delegated to managed care organizations who then have sub-delegated government power to pharmacy benefits managers. Pharmacy benefits managers who themselves have an interest in pharmacies. And there's a and there are no standards to govern it. And so what we're asking the committee today to do is to tell the state that they need to not abdicate their responsibility to pass reasonable rates. They need to not abdicate their responsibility to protect the most vulnerable population and their access to the pharmacy benefits. And most important, we're asking them not to delegate unbridled discretion to the pharmacy benefits managers. It's a fundamental tenet in our way of governing ourselves that you get to know what standards govern your actions. And here, the whole process has gone underground. the pharmacy benefits managers can use data and methodology that they never have to tell the pharmacies what their basis is for coming up with new rates. That would never happen if the state were actually doing its job and passing the rates themselves. They've made this they've abdicated their responsibility to pass rates, and they've allowed a secret process that deprives the pharmacies and the recipients of all data to show how they've arrived at these rates. And so those are a couple of the things we're asking the legislature to help us fix in the interim until they can come back and take a hard look at how they can graft on this fee-for-service system and make it work with managed care instead of trying to bury it within a contract for the pharmacy benefits manager. I'd now like you to hear from Bill Moore, another pharmacy owner.
Good morning. I'm Bill Moore from Sinton, Texas, and I'm glad to be here this morning to speak on behalf